joined on the line by the Minister of Health and Social Services, that is Dr. Kalumbi Shangula. Good afternoon, Dr. Shangula.
Good afternoon, sir.
Please proceed with your update, sir.
Thank you very much. We have received 3,633 results during the period under review. And out of those, 1,496 tested positive for COVID-19, which constitute 41% positivity ratio. The gender distribution, we have 812 females and 684 males. The age is between 11 days to 111 years. The cases are distributed as follows. Erongo, 272, with Walvis Bay having recorded 186, followed by Swakopmund with 78, Usakos with 7, and Omaruru with 1. Oshana, 199, all from Oshakati district. Omsati, 181, with Otapi having recorded 68, Oshikuku 65, Tsandi 31, and 17 from Okahao district. Komas recorded 143, all from the Windhoek district. Ochabanzupa recorded 141, with Ochuarongo having recorded 59, Grootfontein 54, Okahanga 15, and 13 from Okakarara. Kavango is 109, with Rondo having recorded 108, and Nyangana 1. Zambezi 107 from Katima Muliro. Oshikoto recorded 81, with 58 from Onanjoko district, 12 from Omsia, and 11 from Sumat. Hardap recorded 69, with Rehoboth having recorded 41, and 28 from Marianta. Ohangwena 66, with Enhana having recorded 41, and 25 from Okongo. Karas 54, with Rodaris having recorded 38, Karasberg 12, and 2 from Keetmanshoop. Kunene 45 from Opoa district. Omaheke 27 from Khobavis, and Kavango West 4 from Nahudu district. We are reporting cases from all 14 regions, with Erongo region having reported the highest number of cases, which accounts for 18% of all the confirmed cases, followed by Oshana with 13%. Among the confirmed cases are 157 learners, 42 teachers, and 37 students from different institutions of higher learning. We are also reporting 64 healthcare workers who have tested positive, with Oshakati district having reported the highest, which is 34, and the rest from different healthcare facilities. Of all the confirmed cases, 60 were reported to have received 1 dose of COVID-19 vaccine, which represents a 4% of the positive cases. 10 of those are fully vaccinated. In other words, they have received both 2 doses of the vaccine. We have recorded 1,086 new recoveries. They are distributed as follows. Erongo with 511, Komas with 201, Uchabanzupa 149, Hardap 129, Zambezi 49, and Kunene 46. The total number of active cases now stand at 25,636. 581 of these are hospitalized, and those who are hospitalized, 103 of them are in intensive care units. They are as follow. Commerce has 250 hospitalized with 63 in intensive care units. Erongo 71 with 17 in intensive care units. Oshana 50 with 12 in intensive care units. Chobangupa 41 with 2 in intensive care units. Karas 30 with 5 in intensive care units. Oshkoto 26, Omaheke 26 with 4 in intensive care units. Hardap 22, Omsati 16, Ohangwena 15, Kavango East 13, Kunene 11, and Zambezi with 10. We announced 80 deaths from 15 districts. Windhoek recorded the highest number of deaths at 32, followed by Hobabis at 13, Rehoboth at 10, Okahanja and Swakopmund at 4 each. Otapi and Sumeb reported 3 deaths each. Ochvarongo, Marienda, and Ludaris district reported 2 each. Nankudu, Okakarara, Korisas, Okongo, and Oshikuku recorded 1 death each. We need to note that although we are reporting 80 deaths, 46 of the deaths, they happened in June 2021. 6 deaths happened during the period under review, that is between the 9th and the 10th of July. The remainder 28, they happened between the 1st to the 8th of June 2021. Among the deaths, there are 15 home deaths, of whom 6 are from Windhoek, 4 from Hobabis, while Okahanja, Swakopmund, Otapi, Nakudu, and Shikuku have recorded 1 each home death. In terms of vaccinations, now the total number of people who have received vaccinations stands at 131,019, with 30,505 have been fully vaccinated. In terms of the summary, the total number of confirmed cases in Namibia since the beginning of the pandemic now stand at 105,595, with 77,957 having recovered, thus constituting 74% recovery rate. The number of COVID deaths now stands at 1,791, with 200 of them having been died with COVID-19 as a related contributor. In other words, 200,000 COVID-related deaths, giving us a total number of deaths at 1,991. We have so far tested 567,751 samples since the beginning of the pandemic. The number of active contacts now stands at 7,017. People in our quarantine in facility now stand at 4,009. We are recording high numbers of home deaths, either as having died at home or as dead on arrival at health facilities. This indicates that many sick people might not be seeking medical help as early as possible. We therefore urge the public to visit the nearest health facility when feeling sick so that one can receive prompt treatment on time in order for us to avoid avoidable deaths. Finally, we acknowledge the fact that healthcare workers are working long hours to serve the public, whether those who are seeking medical treatment or those who are engaged in the vaccination campaign. We appreciate the recognition of these efforts by members of the public who brings refreshment and other forms of support to these cadres, including the law enforcement officers who are manning the checkpoints. We thank you for this gesture of solidarity and generosity. This concludes today's update, and I thank you.